same. So I just want to take you through to the benefits, the definition as we understand it. Where are the opportunities for you as providers of healthcare and how we can work together. Two pictures here. Somebody mentioned earlier about diagnostics, and I was horrified in one of the, I think it was on World Patient Safety Day. It was diagnostic safety this year, and they said 70% of decisions of treatment are based on diagnostic tests. 20, 30 years ago, it was barely 10%, which means the patient, the family, the person who came with the patient had a say in it. Now the computer has a say. 5 patients earlier came, same problem, and that's how you give the medicines. Did you check who's at home? No, nobody checks, nothing. It just goes on. So this is the advantage of looking at me is that I will collaborate, I will agree to the decision, and this I have seen in children as well. My teenage granddaughter, if I tell her to do something, If I ask her what to do, yes. She may say the same thing, but agreeing on it, taking ownership, participative decision making makes a world of a difference in your treatment compliances and your own outcomes. So the benefits are not just to us as a patient, the benefits are to you as a patient. Collaborative care, patient experience care, patient understanding. We all the time, we're so busy, all of you are very busy, I appreciate that. Certainly, I come from a family of doctors, but that doesn't mean that we don't care. I enter the hospital, I don't know what to do. I don't know where to go, which doctor to see. I have a stomach ache, that's all I know. I don't know whether it's AMR, I don't know whether it's PCOS, I have no meaning. Somebody says she's got PCOS, what's the meaning of that? I know I have irregular bleeding, infrequent or more frequent, and I don't know the harm that comes up. On the other hand, somebody says, may I guide you? You have a stomach ache? Okay, let's start with the physician. Then we go to the gastro person, and maybe lastly we reach the oncologist. So the empathy, the understanding at every stage, even after follow-up, even after discharge is important. So one request I have, I know it's not your job, but I think it's mine as well. And all of you, go beyond borders. Before I come to you and after I go back. So patient centricity does not finish or start at the gate of your hospital. It does not end when you sign up and take the bill. No, it begins there. Please ensure that I know when to come back. The advantages are plenty. Take an example of a ward. Crowded ward, 4 patients, cranky, chronic, acute care. One is sitting quietly with a caregiver. One bed is empty and suddenly a post-surgical person is wheeled in and all the attention goes to that person. Another one is all the time hypochondriac. This is happening, that is happening, no family member, no sister. And I've seen this happening when I was with my sister in the hospital, and I keep seeing that. And nobody to answer, she's continuously ringing the bell so that the nurses say in their own language, don't go, she'll crack you. All she needs is a glass of water. And yet there's another patient, somebody like me, a little more, clued in. And I say, okay, sister, tell me what to do. When should I give the medicine? What drip should I give? When should I stop? What is the speed? When not to do? What not to ask? If the nurse explained to me whose time is saved, the nurse's time. I have plenty of time sitting in that hospital. If she tells me, please look after this patient, I will give the water. I won't let her use the call bed. She can focus on the acute care. She can focus on the acute care. I'll give you a real example. When this was it was the second day of my last chemo, my 6th chemo. I was about to that was my last treatment. My daughter had accompanied me. I was in this wonderful hospital, and everybody was on a symposium like this. 101 doctors, not a single one available. But the nurse, the daycare nurse, she had taught my daughter, if something happens to your mother, namely breathlessness, cold, redness, flushness, please tell me. My daughter had come 6 times already, but yet she repeated it. She explained to it. And my daughter, suddenly, I was very comfortable. I was lying down. The IV was there. The cannula was fixed in properly. The MSET or whatever they were giving me had started. And then they gave me the combination of the drugs. Suddenly, I fainted. I don't know that I fainted. I was flushed. The book I was reading fell from my hands. That shook my daughter. And I was cold and perspiring and non-responsive. I came to know all this later, of course. Immediately, my daughter rang the bell, called the nurse. The nurse immediately took out her emergency tray, came, revived me with some injection, God bless her. I don't remember her name, but I remember her face because there was not a doctor in call. But she had her SOPs in place, and she had taught my daughter. So there was a two-way communication. There was an awareness. There was an emergency protocol. There was a system. There was a method. And I'm standing here today. How many years later? 18 years later. And giving you this example. God bless you. That was an example of patient engagement. That was an example of safety building into the system through three pillars. Awareness. You need to create awareness amongst people like us. Please do not think we are useless, stupid. If you ask questions, don't get upset. I plead with you all. They may be silly questions, but they may be valuable questions. To me, I tell my team is sitting right here, and I say questions are gold. One person, and this we learned in our marketing over and over 50 years, one question means there are 100 more, 1,000 more people wanting to ask, but they don't ask. So take that question and try to find an answer. Second, two-way communication. That's the second pillar. Don't just talk. Don't just listen. I came here, I was fascinated by all the wonderful things I heard, and I'm going to badger you all. You're not going to get away so easily. I'm a very persistent AMR bug, and I stay there, sticking in your system, and please give us the information. Please give us an education so that we can send it forward. But please also listen to us.
Hello.
And the third is bigger than all this, bigger than all of us. It's the culture. Perhaps this hospital has that culture. It is building a culture of safety and inpatient experience, which is larger than the sum of its parts. So, when I mean that, what do I mean by patient education? I've given you an example of engagement. It begins before I reach you, it continues after I leave you. Even when I want to see a doctor, then he just mentioned, my predecessor mentioned about the EHR, the electronic health records, or the digital health records, the PHRs, etc. Everybody doesn't know about it. But I can have a file. I'm old-fashioned. I'm meticulous. I keep a file and I prepare my questions, my answers. How do I do that? No. Or shall I start that? So I want to prepare. No, I want the video running. How do I prepare it? Before I reach or after I reach? I'm running from a hospital. And this is classic of all corporate employees. Age 30 to 45 is the maximum people who are suffering. Early NCDs, early onslaught, severe disease problems, but nobody has time for their health records. Yes, please. Continue.
Hi.
So, if I can prepare my questions. Yeah, sorry, I'll just give you this quick clip. If I can prepare my questions before I reach the doctor, as he mentioned, if I know my symptoms and I write them down, when I come to you, my heart is already beating. I cannot hear my own voice. How will I remember what I planned? I made notes before coming today. I don't remember them. I'm just seeing you and coming to my mind.
This is a short video on how you can get more from visiting a doctor and have a better outcome. Our hospitals can be crowded and doctors can be very busy. At times you may feel that you were not able to explain the situation fully or forgot something that may have been important. If we don't provide complete information about our symptoms and medical history, the diagnosis and treatment could go wrong. With proper preparation, you can make the most of your time. Here are 5 tips for a more productive visit. List your symptoms. Write down all your symptoms before your appointment to ensure you cover everything during your consultation, aiding in an accurate diagnosis and effective treatment. Bring your medical history. Carry important medical records like past prescriptions, test results, surgical details, and your family's medical history. Organize them for quick reference. List your medications. Compile a list of all current medications, including vitamins, supplements, and any known allergies. This helps your doctor tailor treatments and avoid complications. Bring a companion. If you feel anxious or unwell, bring a trusted friend or family member. They can provide emotional support, assist in communicating with the doctor, and help ensure you understand the diagnosis and treatment. Understand the doctor's advice. Take time to understand the doctor's instructions and prescriptions. Ask for clarification on medication names, dosages, frequency of use, and follow-up tests. Also, inquire about symptoms of your illness that need immediate attention so that you and your caregivers can be alert about their occurrence. Preparing beforehand can make your doctor's visit more productive and beneficial, ensuring a smoother and more informed healthcare experience. Thank you for watching.
Yes. Thank you. So, no, go back to the slide. So that was a kind of information, awareness that we create for patients before they come to you. Videos, charts, formats, anything. So the beauty of that is it's simple, it's easy to understand, and we will not blame you because as the theme says and as what our mandate says, we need to reduce, avoid, or mitigate medical errors. They will always happen. Nobody plans them, but they will still happen. Where and who creates these room orientation? I don't know the timings. I don't know the visitors. I don't know the food policy. I just do what I need to do. I don't even know how to dispose of the biodegradable waste. I know a yellow bucket, I know a green bucket, I know a red bucket, I know a blue bucket. Explain that. Don't give me those complex names. But you have a chance. I gave you the example of teaching us and your own time being saved. So there are several places. And I don't mean when I say feedback, so I'm just drawing it in simple. The story begins beautiful tree. Overgrown trees, gate number 2. I don't know where so I go to a big hospital and I ask, where is the pediatric department? Gate number 3. Okay, then I say, where is gate number 3? So where is gate number 3? Where is the pediatrics? Is there a GPS within the hospital? Is there a navigation within the hospital? I enter from emergency because there's a lesser crowd and I mess up the casualty department. So navigation, etc. Okay? So there's lots of feedback techniques, and it doesn't mean just the girl in a black suit coming, tick-tock, ma'am, are you okay? While the nurse is putting my cannula and I say, all okay, just go away from here. So I just want to get rid of her and I give her 5 on 5. That's not feedback. The real feedback comes when I'm in the hospital or about to be discharged, not at discharge times. When my husband, I brought him back after a major surgery a few years ago, and they told me that give him this food, that food. Nobody told me what liquid, what viscosity it should have in the G-bag. I cannot remember. So discharge instructions are very important. And that's what I mean by building a culture. This management seems to have that in place. It's a larger umbrella where everybody, doctors included, nurses, pediatricians, even the diagnostic, the technician, everybody should know. It's like that Taj hotel that burnt down in 2008. The general manager down to the food, the beverages, the front desk, everybody helped the inmates, everybody helped the guests, even if they died. That is a culture. So you motivate them, you mentor them, only then you can monitor your SOPs and your KPIs. That is to me. And we as a Patient Safety Foundation are in the business of creating this valuable, useful, simple education material which we offer you all. Share it with your patients, share it with your nurses, put it up on the posters, in the front desk, on the televisions. Handouts is reliable. We don't charge. We have experts, and we just released a white paper on engaging patients for patient safety in OPD, IPD, and post-discharge areas. Feel free to use them. It's available on our website. Click a photo, take the QRs, and that's for you. So we are here to help us. My health, my health, my responsibility.
My responsibility.
My health, my responsibility. Not just one. My health, my responsibility. Thank you for listening.
Wow. I'm awestruck actually. Ma'am, request you to please stay back.
Any questions? No? Okay, we'll get questions.
I think few keywords which I can recall: partnership, communication, and that too two-way communication. Usually we humans have this tendency of just saying and not listening. I said it yesterday as well. I think listening is the very first and vital part of any communication cycle. And questioning She so rightly said, so many attendants. I mean, I know within family as well, we wanted to ask this, but we thought probably it would sound stupid. But let us be stupid while we are attendant, because we can afford to be stupid and still ask questions and get probably those important answers which would help patients recover. One very important point she addressed was post-discharge and pre-hospitalization questionnaire. Very, very important. I think from a hospital perspective, what she said is, मैं तो पेपर्स लाया नहीं, मुझे किसी ने बताया नहीं. Although हम ये मानते हैं, ये तो समझी हुई चीज़ आपको लेकर ही आने थे. But I think we can take a step towards that, where we are informing the patients, kindly bring your papers, kindly bring your records. It would just take probably 5-10 more seconds, but would facilitate our doctors, our system, and the patient, of course, who's the center of all the conversation we are doing in past 2 days. Thank you so much, ma'am, for putting it so simply, but I think everybody must have understood the importance of that communication and partnership. I would request Dr. Rakesh Gupta to please come on stage and felicitate Ms. Sarita, or Professor Sarita, I'm sorry, no, Professor Nadira. Thank you so much, ma'am. Thank you so very much.